Okay, so I'm starting recording now. So let's start with preoperative assessment. And part of it is Jehovah Witness. Okay, so they brought they have 2 stations in preoperative assessment, and they keep bringing them again and again. And when they try to change, they just add this Jehovah Witness to the things. But it's still same approach. We have patients. We need to prepare him for surgery. So we have our general checklist for preparing anyone. So I think one of the most important things is just to make sure they is still willing to do the surgery. Like imagine you preparing someone for surgery, you start to talk over the phone, they make it telephonic consultations, and he changed his mind from the operation. So, and you're just telling him, I'm going to do this. So always ask about, can you tell me why this operation has been decided, and are you still happy to proceed with the surgery? So the task will be written like surgery has been decided into, for example, 2 days, 2 weeks. So we'll tell him, are you happy to proceed with your surgery in 2 weeks or not? So before you start your assessment. And one of the things, of course, we need to check like just fitness to surgery, like to be like head to toe assessment. When you do the history, like will be systemic review, like if he has any symptoms anywhere in the body, anything is relevant. And investigation will do like full blood count, UNE, liver function test, clotting, chest X-ray, ECG. This is for major surgery, and our patient is major surgery, and we also do cross-matching save. When it comes to save, the patient is you have a witness, so we're going to before we touch to this Jehovah things, let's just finish like any patient preoperative assessment. So as I mentioned, like we do systemic review, but maybe diabetes, cardiovascular disease, and specific medications, we need to check for them because we will need to do some adjustment if they have these things. For example, if he has diabetes, so if he taking insulin, we need to withhold the morning dose just before surgery, and we have to put them in the top of the list. So we'll tell them about this information. For example, if he taking steroids, so they may need to take extra dose during surgery. And warfarin, it need to be stopped like 5 days preoperatively. And clopidogrel, it needs to be stopped 7 to 10 days prior to surgery. And estrogen or hormone replacement therapies can be continuous as long as DVT or BE prophylaxis is undertaken. All right. Also, if like in the abdominal surgery, we need to do bowel preparation, but it's not our case here in the and these things like prophylactic anticoagulation, antibiotics, regular drugs, and stockings. So this is our checklist, but actually this is for post-operative, so we don't need to worry about it in this stations and analgesia. So this is here down in the paper here, this one are for post-operative, our checklist, like if they need any anticoagulation, antibiotics, and IV fluid, and we will write down the regular drugs, and they may need to do TET stockings to prevent clotting, and also, of course, painkiller and antiemetics. So instruction to the patient, so where and when, so it will be written to the task, hopefully, and they will go for admissions. So they, for example, in one operation, they told it just day case operation, so it doesn't need to come overnight. It doesn't need to sleep overnight. And so just make them mentally prepared, like what the operation involves, and what they expect to happen there. And yeah, everything is it's very easy. But when it comes to what is called Jehovah Witness, so this just our division from Christian people, and they just believe that blood transfusion is forbidden for them, even in case of emergency. But they can take IV fluid like Crestroid or dextrose or anything. They can take, no problem. And some of them, they are not very strict, so they will tell blood derivative are fines. For example, if it is like immunoglobulin or albumin or coagulation factors, they will tell it's okay. But you need to ask the patient about these things, like what exactly he refused, like whole blood. And he will tell you, I don't like blood transfusion. Ask him, what about blood products, like red blood cells, platelets, plasma? He will tell you no, because they're all blood. So after that, ask him, what about like some blood derivatives, like immunoglobulins, coagulation factors will help you not to bleed during the surgery. He will, if he said no, so just you need to document this down, write it down, tell him I'll write everything in your notes, and ask him about, you have a witness card. They have their own card it's legally made. So just they have their own legal authorities. So they made this card for them, everything written there, like what exactly they want and what they didn't want to receive during the surgery. So just this is one of the things we need to prepare in our patient, and just tell him and ask him about the card. Most likely they will have it, because even in the hospital they have some people to do this for them. All right, so it's nice, easy station when you know it, I think. Nothing complicated about it. And like any patient, it's not just this patient, but any patient who refused treatment, if they are adult and have mental capacity, so obviously we don't need to force any kind of treatment on them, even emergency treatment. So this patient now is conscious, and he's just came for preoperative assessment. Just you will ask him if he said he refuses, okay, just you need to write this down for him. But because of his situation, just you ask him about the card as well, and just make it more formal. But like if anyone who came to surgery now, right now, and he's conscious, he can talk to you, and he has mental capacity, he said, I don't want blood. You don't need formal papers for that. Just, I don't want blood. Okay, I'm not going to give you blood. That's all. Just he will sign form for that, and that's it. But if when it comes to the children, as you know, like if it is 13 and over, we have this Gillick competency and Fraser's. So we don't. If still we need to check the mental capacity for the kids, and they can sign for themselves. They can give consent that I'm going to take blood, even if like his father is Jehovah Witness. If this child said he's over 13 and he said I want blood, you will check his mental capacity. You will give them the blood against their parents' willing.
And if he doesn't want blood, then?
If he doesn't want, yeah. If he has mental capacity, you need to check it carefully. You are not going to give him.
Okay, if he doesn't have mental capacity, then we have to listen to the parents, or we have to.
Yes, yes. So this is good point. Yeah, if like he has mental capacity and he said no, and this is life saving for him, we can refer to the parent as well, because this is like we need in the best interest for them, and still they are very immature. So it's, yeah, I think we it will be very complicated if they said no for something life saving. I think it's not going to be quick decision. You need to involve senior. You need to. For example, it may need MDT meeting to make the decision for those kids, because even if they have mental capacity still, if it is life saving, it would be very, but it says here in the guidelines, if the child, if it's like life saving, give them treatment. But if the things like this preoperative elective surgery, so we have enough time, so we can take it to the court to make the final decision.
Okay.
Yeah. Okay, so who wants to do it?
I have one question. Like in this case, Jehovah's Witness. So preoperative management, there is a guideline. Like if someone's hemoglobin level is, can I read it?
Yes, please. Yeah.
Okay. So it says that if the hemoglobin level is less than 13 in case of male and less than 12 in case of female, then no need of if patient is iron deficient, then can I send you this in the group?
I
So
can
that you
can
can
tell
better
this.
explain.
I know this. I can tell this. It's
Okay.
like if the female has less than 12 and if the male has less than 13, we give erythropoietin. Like if we can delay the operation, we give erythropoietin and raise the hemoglobin. And if the hemoglobin is less than more than 13, we don't give erythropoietin because it might cause this clotting problem. And in case if there is like iron deficiency, so in that case this erythropoietin will not work. So we have to give, if the iron level is like in certain range, below certain range, we have to give iron in that case. So these are the, I think we don't need to talk about this. You can just say you will check your blood, this hemoglobin level, like blood, we'll do your blood work, and if it is low, we might give you some medication before going for the surgery. We don't need to know all those stuff, I guess.
Yeah, you're right. So just the most important thing to find from them, like find out from them what exactly they refuse, like even like this erythropoietin. So if it is related to the blood, they may also say, no, just make sure, just make things clear for them. And that's all. So because this is like senior decision to decide to give them what treatment if they need it, but tell them just I'm going to write down in your note what exactly you accept, what you don't, and just try to specify to them some of this treatment, like just what about blood derivative? Are you because like they said, some of them they accept it, so you need just to write this down. So the patient refused blood transfusion, however he accepts to take, for example, immunoglobulin or coagulation factors. So you need to just make this clear with the patient. And what about IV fluid? It's obviously they don't disagree with, but just write it to confirm. And that's all. That's all. You don't need to go into more depths. Just as a junior doctor, yes, you need to take from the patient head what they want, what they don't want. But it's not, it's not about treatment. All right, yeah. We need to make it simple. We need to even save time.
Yeah, it will like we have to talk many things before that.
Exactly, yeah. Exactly. All right, so who wants to do it?
I can do it.
Thank you. Who wants to be your patient? It's just preoperative assessment. I came here for my preoperative assessment and he doesn't have anything positive apart from this Jehovah Witness.
Okay, I can.
Okay, thank you. So when you are ready, you can start. It's just 40 years old male came for his preoperative assessment. Surgery has been decided into 2 weeks. And any surgery, like just major surgery, cholecystitis, knee replacement, ankle replacement, bean removal. So it's just major surgery. All of them, they need general anesthesia. And yeah, all right.
Okay.
When you are ready to start, I will telephonic consultation.
Telephonic.
Yeah.
Male patient.
Yes. John.
John, 40 years.
Yeah.
Okay, I'm starting.
Okay.
Hello, good morning. I'm Dr. Shahriar, one of the junior doctors from the hospital. May I confirm who I am talking to?
Yes, this is John.
Okay, okay, John. Before talking to you, I want to confirm few details. Is it okay?
Yeah, sure.
Can you confirm your first line of address and your age, please?
My name is, I'm 46 years old and my address is XYZ.
Correct. And thank you for providing this information, John. I called you to talk about your one of the surgery you are scheduled to do within 2 weeks. I want to talk about this. Is it the right time to talk to you?
Yes.
Oh, okay, John. So before talking about that, can I have a quick recap of what happened actually?
Yes.
Could you please tell me?
Sorry.
Could you please tell me what happened actually and what operation, like what do you know about the operation?
Actually, doctor, I hurt on my in knees, and I had a road traffic accident. So for that, I had to do knee replacement. That's why I was being asked to come for the surgery.
Okay. So when did it happen?
It's 2 months back.
Okay. So how are you doing now?
I'm quite fine, but I'm not able to work, doctor.
Is there any pain?
Yes, I have.
Okay. How are you managing it?
Actually, I need to take a painkiller for that.
Okay. Okay. And do you have any fever or flu-like symptom right now?
No.
Do you have any other health issues?
Yes, doctor, I have.
Okay. So do you have what health issues you are like concerned about?
Actually, doctor, I have diabetes and hypertension.
Okay. So how are you managing your diabetes?
For management of diabetes, I'm taking insulin and oral tablet at night, in the morning.
Is it well controlled with that?
Yes,
Are you taking those insulin and medication like regularly?
yes, always.
Can you please name the insulin and medication for me?
Insulin is mixed 70/30, and medicine is metformin. It is in the morning.
Okay. Can you please tell me the dose?
Yes, so I have to take 10 8 insulin, and for tablet, I'm taking 850 milligram in the morning.
Thank you. So, like, do you check your blood sugar regularly?
Yes,
Okay. So, when did you last measure your blood sugar?
every day I just check my blood sugar.
What is the measurement reading of this?
So which dose you want? Like which?
What was the record like last recording of your blood sugar?
So yesterday I checked and it was normal.
Okay. Okay. Great. And how are you controlling your hypertension?
For that I'm taking medication.
Okay. So, what medication are you taking?
Mm, It's amlodipine.
Okay. So, is it well controlled with amlodipine?
Yes.
Do you have any other medical condition?
No.
Any bleeding disorder?
No.
Are you taking any blood thinner?
Mm, no.
Okay. Are you taking any steroid?
Yeah. No.
Okay. And apart from this amlodipine and diabetic drug, are you taking any over-the-counter drug or any supplements that you
No.
want to mention?
No.
Are you aware of any allergies to any medication or food?
No.
Okay. Thank you for answering this question. Let me ask you some lifestyle questions. Do you smoke?
Well, yes, doctor.
How much do you smoke?
Actually, I smoke like 15 cigarettes per day for last 10 years.
Okay. Do you drink alcohol?
Yes, I drink.
How much do you drink?
I'm
What
social.
do you drink?
I'm social drinker.
Okay.
Like coffee.
Can you please tell me about your diet?
I eat everything healthy.
Okay. Is there any like any problem with your bowel and bladder habit?
No,
Okay. And are you physically active? I know that you are not, you can't walk nowadays, but do you move your hand and feet, like do exercise, uh, like a bit in sitting position?
yes.
Okay. Okay. So, how, like, is there anything that you want to, uh, like, talk to me about?
No.
Okay.
Yeah, just carry on, doctor.
Okay. So I will arrange an appointment with you for your general examination before your like operation. I'd check your pulse, blood pressure, and temperature and respiratory rate. I will also do your whole body like chest and tummy examination, and I will also do some investigations for you. So I will send your blood for routine blood test and your urea electrolyte level, kidney function test, liver function test, and I'll also do heart tracing and X-ray of your chest.
Okay.
Is it okay? So I'll arrange everything for you, and I'll call you once everything is ready. Is it
Okay.
fine?
Yeah.
Okay. So do you have any other concern regarding your surgery?
No, doctor. So, is it good? Is it like that? I have to come on that day? Is it possible that I can come on the day of surgery?
Yes, yes. It will be a daycare surgery. So you will come on the day of the surgery. But before that, you need to you need to take eating, like stop eating food just 6 hours before your operation. So
Oh,
can you do that?
yeah, I can.
Okay. Do you have any other concern?
Yes. So, which anesthesia are you going to give me?
Okay, yeah, this is a valid question. So for this operation, we commonly give this spinal anesthesia. We'll give a injection in your back, and it will numb your body below your waist, and we'll do the surgery after that, and hopefully you will not feel any pain.
No, doctor. I don't want this spinal anesthesia. I'm
Do
really.
you have any preference?
Yes, please sedate me fully. I just don't want to see anything.
Okay, I'll talk about this with my senior, and I'll come back to you and talk to you about your anesthetic preference. Do you have any other concern?
Yeah, what about nausea and vomiting, doctor? I'm really afraid of that.
Yeah, we will give you necessary medication during the surgery. We will give painkiller to avoid any kind of pain, and we'll also give anti-sickness medicine so that there is no sickness during the operation or after the operation. And we'll be covering an antibiotic coverage as well, so that you don't have any infection after after the operation. Do you have any other concern?
Can I walk on that day?
That is a very nice question.
This is
So,
this is post-operative question. Your time is finished.
okay,
Walking and these things for post-operative management.
so you could ask the Jehovah's.
You
Just
didn't ask.
Jehovah Witness.
Yeah, you should ask about Jehovah's. I was
Yeah,
asking
if the patient didn't ask, give him hint, like tell him, you know, like as any operation, sometimes we may need to transfuse some, give you some blood. Is that okay by you? That's it. Just ask him, no problem. Because like even if it's not this Jehovah Witness, any patient preoperative, you can just discuss, touch a little bit if there is any need for blood transfusion or not.
Okay.
And
So,
also, he need to ask about complication of surgery, like common complication, infection, bleeding.
This is
So,
post-operative as well.
okay.
if the patient has a concern about this,
And
we'll
what
talk
about
about.
Yeah.
what about do you have any loose teeth? And like if he needs to give GA,
I will,
like all
What?
anesthesia,
Sorry,
loose. loose teeth or any like dentature problem.
Yeah. So this is anesthesia assessment. You
Yeah.
don't need to go into depths on it. So just tell him I will. They will have another chat with my colleagues who should discuss with you all the aspect of anesthesia and what they're going to do for you and everything. You can touch a little bit on that, but don't go into depths into anesthesia things because it's totally different person is going to talk about anesthesia.
And okay, so what about antihypertensive? So I'm taking antihypertensive. So on that day, I can take antihypertensive.
I have to check
Yes.
Islamine, and then everything
You
will be.
find you can he can take his medication regular as prescribed. He
Just don't
doesn't need.
need to stop insulin, that's all.
Yeah. Okay. Okay, so it's really, you know what, like if you see my paper today is empty, normally I fill the paper two sides for every one of you. Yeah, so today my paper is empty, so very well done, Shahriar. I really like, I'm impressed, like the way you talk is totally different from the different day. Like it's just very professional, very relaxed, and just you finish with time, despite like talking very slowly and thank you the patient for the information, acknowledging back everything. So I think it's extremely good. Yeah, and you cover most of the important things in the stations. Just in the management you told about it's a day case, it's not a day case surgery, this one. So
Oh, yeah.
knee
It is like
replacement. Yeah.
2 to 5 days we can keep.
Yeah, so
And
it's you just tell
come
we
in
will
the
admit
day
you the day
of the operation.
before and you don't need to eat. This is one of the preparation.
Okay.
Like
Okay.
overnight, so you have to be fast overnight and we'll admit you, the day before and we will do everything for you. We'll check everything is all right with you the day before surgery.
So I want to the Jehovah's part actually, just to make sure that I know like everything
So for
correct.
that, you need to ask me that
Yeah.
sometime.
I'll do that. Just we can do 2 or 3 minutes on Jehovah's. What do you say?
Yeah, do it. I think. I mean, I do not have any problem.
Sorry, do what?
Like Jehovah's part. We missed that because
Yes. Just ask him. Like any complication, it could have. As you know, bleeding it's one of the complication in surgery. You may need to take some blood.
Okay.
Would that be okay by you? Yeah.
Okay. So, John, during the operation, there are some complications may arise during the procedure. So, I want to make you aware of it. In every operation, there is the risk of bleeding and infection and like injury of surrounding structures. So, if there is any bleeding, we might need to give you blood, and we might need to give you blood transfusion. So, do you have any concern about this?
Yes, doctor, I cannot take blood.
May I know why?
Actually, it's my religion, and according to it, I'm not able to get any blood.
Okay, so by religion, are you meaning that you are Jehovah's Witness?
Yeah, I am.
Okay, I completely respect your like wish. May I ask you a few questions regarding this?
Yes.
Okay, so can you tell me what kind of product you don't like? Like you don't want blood. So do you want transfusion of blood product like red blood cell, platelet, or plasma?
I cannot take any red blood.
Okay, and do you have any issue with taking like blood components like coagulation factor if we want to give you?
Actually, doctor, I cannot take. I don't know about it detail, but I cannot take red blood.
Okay, so may I ask, do you have any any document regarding your like Jehovah's Witness, so
Yes,
that we
I'm
can?
carrying a card.
Okay, so could you please bring it with you when you are like coming for appointment, so that we can keep a copy of that and we can make sure that you are not taking, they are not like we are not giving you any blood products during your operation.
Yes, sure, I can.
Okay. So as you are Jehovah's Witness, we have to follow certain procedures and we have to make sure that there is less blood loss during your operation. So I'm going to tell you about what we are going to do. Is it
Yeah.
okay?
Yeah.
Okay, so before the operation, I told you about the investigations we are going to do. So we'll take the sample in a pediatric tube so that we collect less amount of blood from from you, and we'll do tests on that. And we'll also make a team of surgeon, anesthetist, and hematologist, and transfusion specialist to talk about your current condition, and if there is anything necessary that we need to be aware of. And am I making sense to you?
Yeah.
Okay. And in the meantime, we will also make ourselves ready for if there is any major blood loss, how can we handle this situation without any blood? So we'll also make sure about that.
Okay. All right.
Okay. Okay. And by any chance, if you want to change your mind, or if you want in blood transfusion before the operation, you just call us or come back to us. We can make necessary arrangement for you.
Okay.
How does it sound, John?
Yes, it's perfect, doctor.
Okay. Thank you. Do you have any other concern?
No, thank you very much.
Okay, good. Well done. So, Shahriar, just I told you don't give impression that you know the script. Like,
Okay. Yeah, I did this. Like, do you want me to tell?
first, yeah, when she told you I don't want blood transfusion.
Mhm.
No. When you told her like if you have bleeding, we're going to transfuse some blood for you. Do you have any concern regarding this? So now you're giving a hint that you know the case. You know the script. Just say, is that all right by you? It's natural to ask, is that okay by you? But
Okay.
do you
Okay.
have any concern? Why? What do you think he must have concern? Yeah. So just
Is that all right?
and again when she told you about I don't want the blood transfusion because of religious, you told Jehovah. Maybe other religious reviews as well. Why you know this Jehovah from?
Okay. Okay. Just we don't need to ask what is this.
Don't ask direct question at all. Just let the patient tell you.
Okay.
Yeah.
Okay. So
Right.
if my religious issue, then we should say, do we have any legal document regarding this that we can keep in your record?
Yeah. So you ask him about the card, which is fine. Yeah. So the card is the legal document. Yeah.
Is there anything like I can take platelet or coagulation factor apart from RBC in case of Jehovah's Witness?
Yeah,
Yes.
the
So
patient will give.
you need to ask the patient. As I told some of the patient, they refuse everything, so they are so religious. It's the same like in our religion. Yeah, like some people they take it very seriously. They forbid everything, and some people 50-50. So the same is this Jehovah. So some of them they accept blood products. Some of them they refuse everything related to the blood. So just you need to ask the patient and specify what exactly he refused, what not, and explain to him like tell him like, yes, I understand that you refuse any blood, but there is also some material or derivatives has been taken from the bloods. Now they become like medicine, but they are not blood actually. Are you okay by them or not? So just you need to specify, name. You can name the name of the medication for them, like some medication that prevents the blood from clottings. They also been taken from human bloods. I was just wondering if you are okay with them or not. Yeah, so take the information from him because they are different. Some of them accept, some of them refuse. All right. Good, let's do the next station.